Greetings and welcome to a new episode of the podcast Positivt. My name is Emmanuel, and in this episode, we sat down with Jan Erik, who's living with HIV and made the move from Germany to Sweden. Let's get right to it. Here we go. So thank you for coming on to the podcast and joining us here today. Why don't we start off with an introduction? Who are you?
My name is Jan Erik. I was born in Germany in 1986, so I'm turning 33 now. I work for IKEA as an interior designer, and I've been working for IKEA for quite some time. I studied something different. I studied linguistics and literature, and I'm a dressmaker by profession. But I'm happy with my creative job. From the HIV perspective, I was diagnosed with HIV. That was when I was 17. So being diagnosed with HIV in 2004 was obviously different than it is nowadays.
Before going into your move, migrating to Sweden, how would you describe your experience living with HIV in Germany?
I think my life with HIV in Germany is and was a very happy one and a very good one, because I never had trouble getting medication or getting consultation for HIV. The thing that is most bothersome from my perspective is the stigma around it. I never had any health issues with it. Apart from the coming out or having the second coming out to my family, to friends, to potential boyfriends, I think HIV never played a role in keeping me from doing something. I was very active sport-wise. I did ballroom dancing as a teenager, pretty professional. I was good at school. I didn't have any sick times where I was at home for weeks a month. It never took a toll on my body, really.
And where was HIV in the process of moving abroad? Did it take a part in the planning and your overall thought process?
It did, and that's actually something that made me a bit sad, because I've always wanted to move abroad, work and live in another country rather than just go on vacation. This particular move from Germany to Sweden was obviously a rather easy one. It's 2019 and not 1999 anymore. But I also knew that within the EU there would be kind of the same standards when it came to health insurance, social systems, medication and stuff. Obviously I did research, but I knew that this would not be as difficult as moving, say, to an Asian or African country.
Considering the research and preparation needed before moving, how was your experience finding information? I'm primarily thinking about information online.
The links that I were referred to basically only ever talked of prevention. So actually living with HIV, or for that matter, moving to Sweden with HIV, that was kind of difficult to find online. And I was very lucky actually to find you guys online, because that was the first time that I kind of had a concrete address or face to HIV in Sweden. Moving to another country would obviously bring changes, and I am willing to adapt to a lot of things, but I had to make this one point very clear, that I wasn't going anywhere where I couldn't receive my medication or would have to pay for my medication myself, which is obviously a lot of money. So I was really happy to make the acquaintance with you and to be able to pose some questions before actually taking the leap.
Once you knew the practical side of things were okay, getting medication and treatment, what about social aspects? Being open, or maybe even laws, judicial matters, or a fear getting into trouble living with HIV in a foreign country? What were your thoughts on that?
I knew that Sweden had a record in the criminalization of HIV, and one of my biggest fears is to transmit HIV to anyone. So I'm really happy that nowadays everyone acknowledges the fact of U equals U, that being undetectable, you cannot transmit HIV to anyone, because that's a huge weight lifted off my chest, that I cannot infect anyone even if I have a sex without a condom. But I knew that this was an issue in Sweden. So that was one of my first questions to you. I quickly realized that obviously those laws were also changing and that there had been court rules that were used as a model case so that the criminalization of HIV was going down in Sweden. And that kind of made it easier for me as well to move here because I did not fear that I would run into trouble with having sex and not disclosing my status or having unprotected sex with disclosing my status. That was just something that I felt like I needed to figure out before because I didn't want to go back into the closet with my HIV status because I've been positive for 15 years now and everybody in my family and friends and work, everybody knows about that, and I would have had a hard time going back because it's such a prominent part of my life and I don't have problem speaking about it, and I'm happy to educate people on it. And if I had to go back, that would probably have been a no then for me.
So jumping forward a bit to the time when you actually started to reside here in Sweden, how did things turn out? Did you know what steps to take in order to get all things settled?
Thanks to you, I knew that in Malmö I needed to go to the Universitetshospital. I didn't bother that much in the first weeks because I refilled my prescription in Germany before I came here. So I had a full stock of 2.5 month medication probably. And I did that deliberately because I didn't want this to be my first thing in Sweden trying to get my HIV medication. And I knew that I would have to get my person number first and the ID card and figure out the health insurance. So I wanted to have a stock of medicine.
So I reckon it took some time until the first appointment. But that contact and how you made that contact, how did you go about that?
Because I didn't have a bank ID by then, which you need to book an online appointment in order to identify yourself online, I booked it via telephone. And that was not a problem at all. My workplace is kind of close. I have a car, so I went there straight after work.
Did you tell them that I'm living with HIV, I want an appointment with you?
Yes,
Or...
yeah, I called them and I was like, I just moved to Sweden, I need an HIV practitioner. I learned that Universitetssjukhus is the only address where I can go to, so I need an appointment to get a prescription, get my blood drawn, get my levels tested. And yeah, then I had an appointment. It was kind of quick, I think like a week in advance or something I made the appointment. And then I went there, got my blood drawn, and they asked me if I had enough medication, and I still had like 2 weeks of medication. So we set an appointment for the week after, so that I could actually see a doctor because the blood is drawn by a nurse. And then the week after, I had the appointment with the HIV doctor, and she would go over my blood levels with me and she would issue the prescription. I took it to the pharmacy right away. I was very lucky to run into a pharmacy that had my medication on stock. I got my 3-month refill and then I was good to go.
I'm thinking about the appointment you had with the doctor. Was there any follow-up on prior experiences and lab tests, or was it more like, let's go from here and let's start from scratch?
No, she asked for my levels before and we talked about like how long I have been living with HIV, if I had any other infections or STDs or whatever. And I promised her that I would bring my HIV record because it's kind of long so that she knows what the past has been like for me. But it's actually pretty unspectacular.
So going into a little bit of comparison mode here, Germany and Sweden in terms of HIV and maybe overall medical care, what's your take on that?
As far as the HIV thing, it was really smooth. You don't have to pay anything for the prescription or for the drug here. So that's something that's a difference. In Germany, you have to pay for the prescription. So it's kind of an administration fee that would amount to 800 kroners a year to have your HIV medication. But then again, that accounts for all the other medications as well. And that is different in Sweden. When it comes to the health system in Germany, I think one of the biggest differences is that from my experience so far, patients in Germany are more free to choose how they want to be treated or treat themselves, because we get more medication over the counter in the pharmacy. You don't have to go to a doctor straight away. If you know what you're dealing with, you can go to the specialist already, and you don't have to go to a Vårdcentral and then they kind of send you to the right doctor. I feel like in Germany people are a bit more free to choose, and in Sweden it's kind of regulated the way it goes. But that's just my assumption.
Looking a bit more at the social aspects, I know it's only been 4 months now since you arrived here, but in your experience, and of course, whatever you want to share or feel comfortable sharing, meeting, dating, what's your overall kind of sense of living with HIV in Sweden?
I haven't really made any really bad experiences, but I have to say, neither have I had bad experiences in Germany. There will always be someone on online dating sites or in real life that will turn their back on you when you come out to them as HIV positive. I think that accounts for basically everyone, and everyone living with HIV will know this experience, and that's kind of a very, very heavy and still very sad situation. Even after 15 years, I feel like that's kind of the shittiest thing that can happen, because it reduces you and kind of completely takes away your personality, and in that moment you're reduced to just a virus, and that just doesn't feel very good. But other than that, I've also had dates here that went really well, and because I usually tell people that I'm HIV positive and that I'm undetectable, hoping that they are knowledgeable or educated at least about that. And I've had dates where people were like, yeah, that's like not an issue to me, because either we're using a condom anyway, or they are on PrEP, or they trust in me saying that I'm undetectable. So it's kind of probably a 50-50 thing. And when it comes to social acquaintances that do not involve sex. For example, I came out to my entire team at work when I was like talking about myself, and the reactions have been really positive. People have been thanking me for being open and sharing about my past or issues that I faced, and I feel like it's such a big part of me, and if I talk about myself and I leave this out, it's kind of lying, because I identify as an HIV positive person, and when I talk about what I do and what I've done so far, there's always some HIV in that. So I don't want to take that part away, because that would, to me, be as if I betray all the people that I have actually gotten to know through HIV. And that's a part I don't want to delete out of my life. And I feel better when I'm surrounded by people who actually know about me being positive, not because I pose a risk to them, because nobody will ever have HIV because of me. I just feel like I can be more myself, and I don't have to kind of limit what I say or to give it a second thought, because whatever comes out of my mouth is the truth, and I don't have to cut this part out of my life.
Based on what you're saying and thinking about that you have been able to both be open to some degree and living your true self, do you think moving with HIV has given you a boost in any way?
Growing up, I was a very insecure person, and there were a lot of things that didn't work out for me as a teenager. Coming out was kind of the only thing to do, because I could never hide that I was gay, and I had to face a lot of bullying and mobbing in school, so obviously that does something to your pride and to your self-esteem. Coming from this dark place and then being hit with diagnosis of HIV as well, obviously that was a difficult time. But I think it's also a chance to really grow, and if you overcome that, and I have overcome that, my maturing and me being 32 now is the better version of myself. And I think HIV has played a really, really big role in finding that self-esteem and finding pride in myself, because everything I do and everything I achieve, I see through a different lens. It's not that I use HIV as an excuse or you should be proud that I achieved that in spite of having a deadly disease. That's not what I feel about it, but I feel my mind rallies around my health and my sexuality and my identity a lot because of being gay and because of being HIV positive. But still I manage to do all the stuff that any sane and healthy person can do, and HIV doesn't rob me of any strength or chance, and that makes me proud, yes.
I'm sure a few of the listeners are thinking about making the move themselves, be it within Europe or from outside of Europe to Europe or in any other way. What advice would you give to them? And what advice would you wanted to have when you were starting this journey of moving to another country?
I wish somebody had done that, and I would have probably made the move earlier during my years at university, for example. I think it's really, really important to push aside the feeling of HIV is restricting me from doing something. Obviously, yes, there are countries where you simply cannot move to, which I luckily had not on my list. But my advice would definitely be go and research how the situation for HIV positive people is in that country. And there will always be some kind of organization that deals with HIV. Get into contact with them, find out how the treatment works, how the pay for the medication works, how the sentiment maybe of the population towards HIV, because that's also something that I think differs from country to country because of the level of education, because of the level of knowledge, medical knowledge. And if you feel like you can deal with those things, because you find out that you can get the medication for free, the community that you will live in is kind of okay with people being HIV positive. You don't have to fear for your safety when you come out to anyone, or you don't risk being imprisoned because there is some weird law about HIV. Then HIV should not be the decisive factor. I mean, to me, there were a lot of other factors that were decisive. If I hadn't had a permanent full-time contract in a company that I had worked with 10 years before, and I knew I had this security in the other country, I probably would not have done it. But that was not related to HIV. That is just because I'm German and I have a need for safety, and I wouldn't have done it if it was for moving to another country, getting another job, starting on a temporary contract. Those were things that I ruled out for me, but they were never related to HIV.
And with that said, we conclude this episode. A special thanks to Jan-Erik for participating and making this possible. For feedback, questions, and suggestions, feel free to contact us at www.pgsyd.se. That's pgsyd.se. Until next time, check out our previous episodes where we cover a whole host of perspectives in relation to living with HIV. Over and out.